Hey guys, it's Allie. I hope you're having a wonderful day. So I wanted to talk to you today about the difference between home care and home health. A lot of times people will use those expressions or that terminology interchangeably, and it is not interchangeable. So let's talk about it. First of all, home care is also called companion sitters or private sitters. So companion care is designed usually for someone to come into your home and care for your loved one while you're unavailable to care for them, while you're working, while you run errands. Normally speaking, these companies are either large national companies or they can be small private companies that are local to your community. Most of the time, those are covered by long-term care insurance policies. If you have that, although you need to check with your long-term care policy and see if there is kind of a period of time that you have to pay into or private pay first before you get reimbursement. So that is between you and your insurance company. But if you have long-term care for your loved one, it is definitely worth looking at. So home care is a fantastic option if you are concerned about leaving your loved one at home. And please, if you are concerned, follow your gut, because oftentimes that's when things happen, is if we don't listen to the little voice inside of us that says this is not a good idea. So if you have a loved one who you've already had to unplug the stove or lock up medicines, or you already have cameras on them and you're worried about them all the time, that is a situation where home care is fantastic. And if you have the private funds to do so, or you have insurance, it's a great time to activate it and go ahead and make sure that the person has that support. So home care is private pay. It is not covered by Medicare or Medicaid or private medical insurance. It is not a medical service. It is a care service. So home care providers are trained, and they normally can, they've been trained to safely transfer your loved one when they have to use the bathroom. Often they will help with bathing. They can do light housework. They can provide just companionship and sit and watch TV with them. They can take them to the grocery store or take them to doctor's appointments. They can do a lot of the same things that you or your family members can do, but they just have more training. And it can be a huge help, and it can be a big peace of mind to have that. Okay, so next, home health. So home health is very different. A lot of times people will use that expression home health and they're talking about home care. Okay, home health is different. Home health is a medical service. It is covered 100% by Medicare and Medicaid most of the time. It is covered by private insurance. If you will have occasions sometimes where someone tries to use a certain company and that your insurance doesn't cover that company, but generally speaking, it is paid for 100%. So what is home health? It is not a sitter service. They cannot guarantee that they're going to be out there for a period of time so that you can go to the grocery store or go to church. They are coming to do medical care. So there are nurses and they can do wound care. There are CNAs that can assist with bathing and grooming. So that's a fantastic service. And they have therapists. So they have physical therapists that can help your loved one improve their strength and agility. And they might work with them walking up and down the sidewalk or walking around the block or just helping them get safely navigated to the bathroom. Now, the other thing is a lot of times when people change locations, they've moved in with a loved one or they have been at rehab for a while, or they're moving from like an assisted living and they're coming back home to be with family. That is a prime opportunity to have occupational therapy. Occupational therapy helps the person navigate in their new environment, helps them figure out the easiest way to get up and down off the commode or to get down the hall, or the things they need to remember as they're passing from the carpeted area to the hardwood area. So they are fantastic at kind of resetting your senior's brain on how are we going to navigate this new environment. So that's fantastic. And then you also have speech therapists. Well, when I first heard about this, I was like, what? Speech therapists? They're not coming in to help the person say their words correctly most of the time, while that is something that they can do after loss of ability because of stroke and things like that. They usually are actually more focused on things like swallowing. So one of the things that happens commonly with seniors is that they may have trouble swallowing. A lot of times when you have dementia, you lose the ability for you to kind of get food down your throat. It's just like a muscle loss. It's like a memory loss in your muscles. It's very strange, but it does happen. And so that's when you have people usually that have thickened liquids or purees or whatever. So they can help a lot of times with help swallowing and they can let you know what's safe and make recommendations about pureed diets and thickened liquids. But they also can help with someone who, because of dementia, is pocketing their food. So you may have experienced this where your loved one is putting food in their cheeks instead of swallowing it. So sometimes that can be very helpful to have a therapist who works with your loved one on that. And just due to GERD and acid reflux and the way that it affects the esophagus, sometimes someone will need speech therapy to help them with that. Okay, so home health is designed to try to get a person back to baseline. So what that means is if they were functioning at a certain level right here before an event happened, before they went into the hospital, before they had a fall, then our goal with home health is to get the person back to that stage, okay? And sometimes it can happen and sometimes it can't, but that's the goal, okay? And also treating wounds is very important and something that home health does do and does a fantastic job doing. So home health is covered by insurance. It is a medical service, and it is very different than home care, which is a private service and something that the family contracts and has so that you can have care in the home. Now, people ask me, can they have hospice and home care? The answer to that is yes. However, hospice will not pay for home care, unfortunately, okay? Hospice is also a medical service. It's covered by Medicare, Medicaid, and most personal insurances. So what's going to happen is that you can have sitter services, companion services, however you want to call it, home care in the home. And a lot of people who have hospice need that. They need the support for their family member who's the main caregiver, or maybe the family still needs to work or whatever. So home care is really vital and often used for people who are on hospice, but unfortunately Medicare will not pay for it. So again, private pay. And then people will ask me, can I have home health and hospice? The answer simply is no. Okay, the simple answer is no. And the reason being is that home health is designed, as we just said, to get the person back to baseline. Whereas we know with hospice that this person is declining and we are not going to get back to baseline and short of a miracle, usually, okay, because of the disease process that the person has, because of the damage. Let's say if they have CHF, the damage that they have to their heart, it's not going to improve, and exercising isn't going to improve it. As a matter of fact, it could cause them to get worse. Okay, so for example, if they have advanced dementia, they're not able to follow the commands to do the exercise, and they just get frustrated, and it's a frustration for everyone. So generally speaking, you are looking at a very different situation. So a lot of times families will kind of hold on to home health because they want their loved one to get better. And I'm telling you that we want that for you too. But if it is not happening, if your loved one is not improving, if they are flunking out of home health services, then they might be a candidate for hospice, because that decline that you're seeing in them usually is created by a disease process that's happening in their body. It's something that we cannot reverse. And if that's the case, they may qualify for services. Okay, so you cannot have both home health and hospice, right? So that being said, you can have hospice and home care, but you have to pay for home care. You don't have to pay for hospice. All right. All right. So the only other thing I'm going to add to this conversation is that I think it's fantastic that someone has someone like Miss Judy from church who can come and sit with mom and hang out with mom and keep her busy and play puzzles or whatever for the afternoon so that someone can run to the grocery store or get a mental break. I highly encourage that. I think it's wonderful. But please understand the short falls with that. Okay. Miss Judy from church most likely is not licensed, bonded, and insured. And if Miss Judy gets hurt in your home, you're going to end up responsible. So God forbid mom and Miss Judy end up on the floor together. You're going to have a whole world of hurt and a world of trouble. Okay. The other thing is Miss Judy may or may not be trained to properly transfer your loved one, if she's trying to use the commode or if she's trying to get out of bed. So just consider that when you are considering what your options are. We all have limitations when it comes to finances, so I understand that not everyone can afford home care, but if you can afford it, if you do have long-term care insurance, definitely consider it. It's a fantastic option. It can keep your loved one safe. Home health is fantastic because it can help your loved one get used to a new environment. It can help them improve, help them gain muscle tone. And of course, you know that I love hospice. Hospice is support for the family in addition to the patient and is there to support you through the process of the decline of what is happening. And a lot of things are covered for free, unfortunately. Again, one last time, for those in the back, home care is not covered by hospice. Okay, thanks so much for listening today. I enjoyed talking to you, and I am here to help you if you need me. So reach out and have a fantastic day. Bye-bye.